Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with infections, infestations, and the immune system, starting with the letter E. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues of your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and metabolism and infections, infestations, and the immune system, then issues surrounding fertility and pregnancy, childbirth, postnatal problems, then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus. Or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Nature-Mir people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, ganglion, of a stooped appearance, with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed various videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let us continue with learning how homeopathic treatments can help with infections, infestations, and the immune system, starting with the letter E. Infections are an almost daily occurrence, but if we are healthy, our immune systems deal with them before we notice any symptoms. Some microorganisms enter the body through the nose and mouth, in the air, in our food, sometimes on dirty fingers. Some enter through cuts and abrasions, while others invade the urinary or reproductive tract through the urethra or vagina. Many of the microorganisms with which we share this planet are harmless. Some permanently inhabit the inside and outside of the human body. A few even produce substances useful to it and prevent harmful bacteria from finding a foothold. This is true of certain bacteria in the large intestine and vagina. Some bacteria are harmless in one part of the body, but damaging in others. This is true of E. coli, which is benign when it's in the colon or rectum, but harmful if it is transferred to the urethra, vagina, or mouth. Each kind of microorganism, whether it is a bacterium, virus, fungus, or blood parasite, carries special chemical markers known as antigens. Some strains of lymphocytes, which is a kind of white blood cell produced in the lymph nodes, spleen, bone marrow, adenoids, tonsils, and the wall of the gut, recognize antigens and stimulate other lymphocytes to produce proteins called antibodies, which then disable the carrier organism. Other lymphocytes directly attack and destroy the invading organism. For about 6 months after birth, babies are protected by their mother's antibodies. After that, the immune system is sufficiently mature to start manufacturing its own. Homeopathic immunization does not involve introducing live or dead viruses or antibodies into the body. Instead, remedies are prepared from diseased tissue or secretions using the traditional dilution and succession method. Like other homeopathic remedies, they contain in highly potent form the essence of the source material used. In this case, the essence of the disease organism and its toxins. The body reacts to such remedies, known as nosodes, by sharpening its immune response. The production of antibodies in response to antigens, the so-called immune response, is not the body's only line of defense. The body's first-line troubleshooters are neutrophils and macrophages. These are two kinds of white blood cells that constantly patrol the bloodstream and tissue fluids and respond immediately to the chemical and thermal signals sent out by tissues when they become inflamed. If inflammation is suppressed, white cell activity is impaired. Neutrophils and macrophages gobble up and digest offending microbes, foreign particles, and other noxious elements. The resulting pus is a mixture of necrotic tissue, dead bacteria, and dying white blood cells. Infections can be treated by killing the germs that cause them or by helping the immune system to deal with them, or both, depending on general health and the virulence of the infection. Traditional antibiotics can deal with bacteria, but not viruses. After a course of antibiotics, live yogurt or kefir, eaten daily for at least 5 days, helps to repopulate the gut with the beneficial bacteria that the antibiotics have killed, along with the harmful bacteria that was their main target. Homeopathic remedies, improved nutrition, fresh air, exercise, and rest can restore the coping ability of the immune system. In some cases, homeopathic remedies and antibiotics used together may be necessary. Constitutional homeopathic treatment is always advisable after serious infections. Occasionally, as a result of aging or exposure to certain viruses, bacteria, chemicals, and environmental factors, the body loses some of its ability to discriminate between self and non-self, or fails to recognize and destroy its own abnormal cells. The first kind of impairment leads to autoimmune diseases such as rheumatoid arthritis and systemic lupus. The second leads to cancer. Allergies, distressing reactions to certain drugs, chemicals, food, and other substances that seem to be tolerated by the majority of people are the downside of having an immune system. Ebola. Ebola is a member of the filovirus family. It is a hemorrhagic fever. The symptoms of Ebola include severe fever accompanied by muscle pain, weakness, vomiting, and diarrhea, and in severe cases, unstoppable bleeding that ends in the shutdown of the vital organs. Exposure to the virus usually comes through direct contact with the blood or secretions of an infected person or animal. The disease may be transmitted to another through sexual contact for as long as 2 years after clinical recovery. The incubation period for Ebola is anywhere from 2 days to a more typical 8 to 10 days. However, infections have been known to arise 3 weeks after exposure. If someone is not symptomatic in 21 days, it is not likely that they will become symptomatic. The symptoms of Ebola are typical of viral infections such as influenza. There is a fever higher than 101.5 degrees and a significant fatigue and tiredness, which commonly takes the person to bed. There is also a flat, slightly raised rash on the face, trunk, and arms. After this influenza-like beginning, on day 5 to 7 of the infection, there is muscle aches, joint pain, and severe headache, as well as loss of appetite, abdominal pains, nausea, vomiting, and severe watery diarrhea. There's also a sore throat, difficulty swallowing, shortness of breath, and chest pains. Ebola is spread by contact with bodily fluids such as blood, vomit, diarrhea, saliva, and semen. It also seems to be transmitted by eating animals which carry the virus as a reservoir. Objects coming in contact with the fluid, such as utensils, cooking materials, cups, glasses, needles, and so forth, can carry the virus from an infected person. Bed rest is absolutely necessary, as well as isolation and quarantine. Please note that Ebola can turn into a critical, life-threatening condition. Hence, you should not be treated only by homeopathic remedies. Hospital supervision of the patient is very essential. Specific remedies to be taken 4 times daily. The number 1 remedy to use is Crotalus Horridus, 200C. It is indicated when there is difficulty in swallowing due to spasms and constrictions in the throat. The tongue can be fiery red, smooth and polished, and very swollen. In diarrhea, the stools are black, thin, and offensive. Dark purple-colored blood that will not coagulate, bleeding from any part of the body, including the eyes, gums, nose, and the sweat. Offensive discharges. Edema with purplish mottled skin late in the disease. The person may turn yellow. There is sepsis, blood boils, and severe prostration, and the pulse may be scarcely felt. The person cannot lie on the right side or back without vomiting, with a tendency towards jaundice. In this case, use Crotalus Horridus, 200C. The second most important remedy is Bothrops, Lanceolatu, 200C. This is for retinal hemorrhage and from all orifices, pulmonary embolism, worse on the right side, black vomit, cold sweat, trembling, can't talk, photophobia to sunlight, one-side paralysis, nervous trembling, difficulty articulating speech, sluggishness, swollen puffy face, and black vomiting. There is thrombosis causing neurological phenomena like strokes and bleeding from all orifices, blindness, especially in the daytime, fever with shivering followed by very profuse cold sweat. Use Bothrops, Lanceolatu, 200C. Next is Lachesis Mutus, 200C. Look for delirium with trembling and confusion. The person may talk too much, tongue dry, black and trembling. Lots of profuse hemorrhage from anywhere in the body. The blood is dark and does not easily clot. Great sensitivity to touch. Often tight clothing cannot be tolerated, especially around the neck. The person feels better for heat and worse on the left side. Disease begins on the left side, then goes to the right. Perspiration is cold and stains yellow, and it may be bloody. Use Lachesis Mutus, 200C. Next is Phosphorus, 200C. For hemorrhage where there is bright red gushing blood from anywhere in the body and profuse watery diarrhea, longing for cold food and drinks, but as soon as water becomes warm in the stomach, it is thrown up. Perspiration has the odor of sulfur. Aggravation in the evening before midnight and lying on the left or painful side. There is a lot of anxiety and fear, especially at night. Use Phosphorus, 200C. Next is Mercurius Corrosivus, 200C. This remedy is indicated for dysentery and persistent need to evacuate the bowels that is not relieved by passing stool. The stool is bloody, slimy, and offensive. There is also a constant need to pass urine that is not relieved by passing the urine. The urine is hot, bloody, or brown. Urine is often scanty or suppressed. There is copious bleeding that is better when lying on the back with the knees bent up, with delirium, headache, with burning cheeks, photophobia, black, swollen lips, metallic, bitter, or salt taste in the mouth. Use Mercurius Corrosivus, 200C. Other helpful remedies for Ebola are Camphor, Carbo veg, and China 200C potency to help with the loss of body fluids. Echis Carinatus 200C to be used for hemorrhagic Ebola with a state of anxiety followed by a fear of impending death. Echinacea Angustifolia 200C for when there is a septic state developing, blood poisoning, fetid smelling discharges, and enlarged lymph nodes with profound prostration, very weak and tired, severe headache, and the brain seems too large for the skull, with white coating of the tongue with red edges, bed sores, and blood that follows the stool. Use Echinacea Angustifolia 200C. Pyrogenium 200C. Use when the well-chosen homeopathic remedy fails to improve symptoms. There is great restlessness, the bed feels hard, and the person feels bruised and sore. The stool is large and black and carrion-like, and the pulse is abnormally rapid and out of proportion to the temperature. Use Pyrogenium 200C. Terebinthiniae Oleum 200C. Use when there is an affinity to bleeding mucous surfaces and has a particular affinity to inflammation of the kidneys following acute disease with dark passive fetid hemorrhage. The urine may be scanty and suppressed and smell of violets. Constant urge to pass stool. The tongue may be dry, red, sore, burning in the tip, with prominent papillae. The breath is cold and foul, in fever, heat, with violent thirst, with cold, clammy sweat, choking sensations in the throat, nausea and vomiting, difficulty breathing, and bloody expiration from the lungs. Use Terebinthiniae Oleum 200C. Secale Comutum 200C for the collapsed state. The face is pale, pinched, and sunken. Diarrhea is profuse, watery, putrid, and brown. It is discharged with great force, exhausting, painless, and involuntary. The person may crave acids and lemonade despite the diarrhea. Urine may be pale, watery, or bloody, or it may be suppressed. Thins, slow, painless, dark, oozing of blood with offensive putrid odor. Tingling in the limbs, white, cold extremities, painful. The person wants to be uncovered, although the skin feels very cold to the touch. They feel worse from heat and from any motion. Use Secale Comutum 200C. Also, you can use the Ebola Nosode 200C. Self-help. Use a calendula tincture wash. Use 2-quart bowl of water, add 1 dropper full of calendula tincture. This may be used as a soak, wash, or poultice for inflamed sores that are not healing. This can also be used as a spray. It is thought that Bothrops Lanceolatu 200C can be used as a prevention to Ebola. Use 4 drops of Bothrops Lanceolatu 200C daily for the first week after exposure, followed by 1 dose of Bothrops 200C daily for the second week after exposure. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video.